The exposure to negative events emotionally overwhelming can lead to traumatic memories, an altered sense of self, emotional dysregulation, and avoidance. Hi, my name is Brianna Zeno, and today I'm going to be telling you about the correlation between mental illness and childhood trauma. I've done extensive research on disorders of all kinds that may be a result of early trauma. First, I will tell you what childhood trauma entails. Second, I will inform you of multiple disorders that may develop due to this trauma. And third, I will bring awareness to the steps one can take to take care of their mental health. Let's begin by talking about how childhood trauma transpires. The most common event is violence and sexual abuse within the child's family, and it is very uncommon for a child to report either of these out of being afraid. According to Delphina Gennari, worldwide, it is estimated that 150 million girls and 73 million boys have experienced sexual violence. Reports indicate that family members often constitute a high proportion of the perpetrators. Now that we've discovered trauma and how it comes about, let's talk about the disorders resulting from traumatic circumstances. According to Franco Benazzi's seminar on bipolar disorder is defined by recurrent periods of highs and lows of mood, including combinations of manic or hypomanic and depressive symptoms in the same episode. Someone living with bipolar disorder may lack energy, have trouble sleeping, experience hallucinations and delusions, and are at significant risk for committing suicide. The book, Childhood Trauma and Mental Disorders, states that childhood abuse and neglect have been reported by 51% of patients with BD. Specifically, 24% reported physical abuse and 21% sexual abuse. Trauma also contributes to dissociative disorders, which are a group of mental health conditions that involve disruptions or breakdowns of normal consciousness, awareness, and memory. They are often characterized by a sense of detachment from oneself or reality, as well as significant gaps in memory or identity. Research has shown a strong correlation between these disorders and childhood trauma. According to American Psychiatric Association website, one study found that nearly 90% of individuals with dissociative identity disorder reported experiencing severe childhood abuse, including sexual, physical, and emotional abuse. Dissociation helps to cope with overwhelming emotions and memories associated with the trauma, which further leads to the development of these disorders. Mental disorders stemming from childhood trauma can be debilitating, but let's discuss the various treatments available to alleviate symptoms and improve overall functioning. According to the National Institutes of Health website, the treatment approach and causes of mental illness adopted by participants were in harmony with the group they belonged to or the culture they lived in, while some participants discussed psychological and psychiatric treatment as a preferred choice for mental health problems. The assessment on choosing which treatment is right for the patient should focus on what the patient's beliefs are. Seeking professional help and utilizing evidence-based treatments can lead to significant improvements in mental health outcomes for those who have experienced childhood trauma. So, I have discussed first what childhood trauma is. Second, I have talked about a few of the disorders that stem from this trauma. And third, I have mentioned a few treatment options to consider when seeking help. I will leave you with this quote from Russell Wilson. If we start being honest about our pain, our anger, and our shortcomings instead of pretending they don't exist, then maybe we can leave the world a better place than we found it. Thank you.